Ladies and gents, a new upgrade session is about to begin. Download the best version of yourself now.
I'm very glad to be invited to speak with you, actually from the US, as you heard. My company is MedicaSoft, where we're doing software for hospitals and doctors and patients. And we work very, very closely, we have for many years, with our partners here in Romania, InfoWorld. And between InfoWorld and MedicaSoft, we're designing and developing, implementing EMR systems, personal health record systems for patients, blood bank, radiology, very broad spectrum of software in the healthcare space. And actually, I think I'm free here to walk around a little bit since we have this mic, if that works okay. What I wanted to speak about a little bit today is between my colleagues at InfoWorld and our team at MedicaSoft, we see an awful lot of things that are developing in the medical field, really around the world. And often we're asked about two big things, interoperability and cybersecurity, and how those either help or hurt or speed up or slow down something that someone wants to accomplish with IT. In fact, I would say maybe you've experienced the same thing. We hear the questions so much that interoperability, cybersecurity, words like this, sometimes it becomes like a buzzword, you would say. People kind of forget the meaning. What does it actually mean? So we wanted to actually step back for one moment here and this morning talk a little bit about what does that actually mean for us? Is this helping us? Is this hurting us in getting done some of the things that we want to do? So first of all, we should say what are the reasons that we would even consider the challenge of interoperability or the challenge of cybersecurity? And I think for one thing, you can just look around the halls that are here today. Some of the colleagues that are here, the things that they're working on are absolutely amazing. 3D imaging, we hear about artificial intelligence, clinical decision support, and many, many things that are trying to help doctors, nurses, physicians deliver better care to patients. How can we get them more information? How can we help them do their job so they can focus on healthcare and not have to try to be a data clerk typing or something like this? There are many things that are trying to actually help patients be more involved in their own healthcare. Many personal devices, some of you may have on Apple Watch or some other devices, Fitbit and so forth. There are many ways that we can ourselves be more aware of our own health. Even on the administrative side. I know this is for sure true in the US and I think true around the world. The way that healthcare is paid for is changing. When the way that it's paid for changes, suddenly people realize they need different data than they needed before. Am I getting paid just to run a test? Or am I getting paid based on the outcome? Is this patient actually improving in health or something like this? So many, many things are happening in healthcare, many new technologies, blockchain, machine learning, and so forth. And these are all great things. One thing that we know that all of those things have in common is they need more data. I think we heard an excellent description from Girhan about the data needs within a hospital, within one EMR system. He gave you a very good description of some of the challenge and the opportunity. If you can capture the data electronically, make it available and accessible to physicians, how useful is that? And you've heard from him that once people can use data electronically, they don't really want to go back to using data on paper. Well, in some of the things that we're talking about now, the level of data is even beyond one EMR system. Now, if you need to look at what the health is of a patient over an entire procedure, let's say, not that I am a candidate, but maybe hip replacement or something like this, you need to know what is the history of that patient? How did they get to the physical state that they're in? Then the actual encounter to have the surgery, the joint replacement, the follow-up care. This will involve more than one physician, more than one facility, more than one hospital, clinics, doctors. Each one has its own system, even if they are advanced and electronic. They're not made to share the data. If we're speaking about something as advanced as cancer treatment, choosing a drug based on your genes, your genomics, to really target a treatment that will be right for you, the amount of data is exponential. And it's not something that the current systems are really built to handle. Most, I would say actually, all EMRs today are not yet built to factor in your genomic background when a diagnosis is made. But we know that clinicians are beginning to want to do this. Drug companies want to do this. So there's a need to bring all of this data together. Sensor data, we've seen a lot of things in the hospital for monitoring, at home for monitoring. How can I share that data? Again, it's the same thing. You have more than one system, which each system itself may be quite advanced and electronic, but were they built to bring this data together in one place? Not really, usually not. And again, I always feel that we shouldn't leave out the administrative part, financial part of healthcare. In the hospital, the people who are doing the measurements and making the payments also need more data on what are the clinical outcomes, what is the efficiency, what is the cost, and what is my best administrative and operational efficiency solution. So we find that when you have systems that maybe were not originally designed to share data, but we have IT people, we have companies like my company, MedicaSoft, like InfoWorld, working very closely with CIOs and CMIOs, as we heard, we can start to create systems that will bring this data together. One of the first challenges that we have, though, now it's a very real term and not a buzzword, but data interoperability. How can we share the data in a way that's usable? And actually, for technology people such as myself, we break down interoperability into 3 levels, let's call it. There's foundational interoperability. Is it just possible for me to give you some data? Forget what it means. Just for us to exchange it. That's one level. The next level is, do you know what I'm sending you? That this is a continuity of care document or the summary of an encounter or something like this. Structural interoperability. On top of that, semantic interoperability. Okay, I was able to send it to you, but are you able to use, let's say, this medication information in a clinically relevant, safe way? That means that do you understand this data to mean what I understand it to mean? So there's interoperability at all levels, foundational, structural, and semantic, in order to make these things work, to bring together data to do the things that we all want to do. So it's at this point usually that we, from a systems point of view, need to look at the cybersecurity and privacy aspect. There's one thing that we know for sure from not just healthcare, in every industry. As soon as you start to bring data together into one place, it's very valuable. It's valuable to us because we're trying to improve clinical care or operational efficiency, but it's valuable to other people as well. It's valuable to the hacking community because if they can access this data, it's obvious that it's much easier for them to hack one central source of data and extract information about you, not just your health information. All of your financial information is tied in, information on where you live and so forth. The more we bring this data together, the more it's valuable and the more it's attractive as a target. So this is a big problem, and we have to build in security and privacy checks right from the start. The other thing that we should think about here, though, is it's sometimes what we call a chicken and egg situation. You're not able to bring together the data unless the people who own that data are able to share it with you, if they're willing to share it with you. If they don't trust that you can protect the data, if they think it's a security risk, you will never get it in the first place. So we spend a lot of time thinking about how can we demonstrate that a system is secure so that we know it's secure, but the people who we want to give us the data, that they can actually trust it. Once we have a trust, then we can address interoperability and begin to use the data. But the reverse is a big problem. If there's no trust, you never get the data and you can never solve the problem. So what do we do? Well, for companies like MedicaSoft and our colleagues at InfoWorld, we really think that a standards-based approach in software is the best way to go. Standards give us the ability to do the interoperability exchange that I mentioned. If we agree on a national standard, and here organizations like HIMSS and HL7 are very helpful to give us ways that we can all agree on how we should share data. The other point about standards is, if we've agreed on some standards, we can also agree on a common way to protect the data. We can agree on a standard for encryption. We can agree on standards for authentication, for role-based access control, who gets to use this data. So for companies like ours who are involved in providing software to drive all of the innovation in healthcare, we feel very strongly that a platform approach using standards gives us both of the things that we need here. Interoperability, so we can use the data, and the means to protect it so that we're protecting security and privacy. Thank you very much. I think maybe we'll have a few questions.
Thank you so much. We can take one question, please, maybe even from Bogdan here. Thank you so much for bringing this topic, especially in Romania, because we don't have much. I think we are just starting to think about interoperability, really. So I think that's very, very useful for us. And I would like to take a question, if you have any questions. Yes.
Hi, I'm Jon from Fresh Blood. You seem to have a lot of experience. Very short. What would be the major driver of change in the IT health system implementation? What you have seen?
Okay, so I'm not sure if you think I have experience because my hair is gray now, finally. But in any case, there's actually two things that we find that drives change. The one that we don't think about often is payment, as I mentioned. So when payment changes, it really goes from the top, trickles down, because I'll give you a simple example that we're finding in the US. Payment has been for many years what is called fee for service. If I provide a test, I'm reimbursed for that. There's some experiments, let's say, that are for what is called bundled payment, which says, don't tell me about each procedure that you did. I will pay you this amount of money for knee replacement, let's say. Now it's up to you. How do I spend that money? All of a sudden, the people who are thinking about payment and efficiency, they want to know about outcomes. Well, which process gives me the best chance of the success with the patient? Because if I need to provide more services because the first one didn't work or they're readmitted, it's costing me real money. So we never like to think that money is the most important thing in healthcare. We think it's people and it's our health. But actually, the money can drive the behavior, and if it's done correctly, it can drive a good behavior. So often payment is one. The other thing is basically what provides the best health outcomes for patients. And as soon as you ask that question, you go from looking at one system, maybe one EMR, to looking at population health and what has worked across it. And that's a big IT challenge and a big IT opportunity.
Our life is an algorithm. Our brain is an operating system. Keep it updated. ICEEfest. Upgrade to your best version. Powered by Orange. Innovation partner Glow. Driven by Nissan. Good mood partner Kaufland. In association with M Platform.